Good morning, Limitless Network. My name is Zamil Solanki, and it's a pleasure joining you again with, Tea with Z on Tea with Z. A very good morning to you. If you haven't gotten your tea yet, or whatever your hot beverage is, go and grab that now. Today we're going to talk a little bit about service delivery and utilization of those services from your local healthcare provider. And the reason why I wanted to sort of bring this up today in this topic is over this past week, actually over the past, few months since the COVID-19 vaccine started to roll out, we've seen a lot of our local healthcare bodies really lobby and push the government to utilize their ability to deliver services to a community on a grassroots level very, very quickly, very, very efficiently, very, very effectively. And we've seen that with the rollout of both pharmacist delivered and GP delivered vaccination clinics, particularly for the influenza. And we've seen the real ramp up and effect that's had on the well-being of our community, but also the well-being of our healthcare system in general, and the ability for our healthcare system to cope with outbreaks of influenza in the past and things like that. Now, we all know that we're going through COVID-19 right now. That's no news, no new news to anybody. But what is, I guess, really relevant right now is, the real big media hype around the botched COVID-19 rollout. And, at the end of the day, we are very blessed in Australia, and I'm not going to get into the politics of it at all, because at the end of the day, that's a whole separate discussion, and that's not what we're about. I'll leave that to other reporters and for your own take on that. But when we look at the COVID-19 rollout and the pressure to actually deliver a vaccine on such a wide scale, at the end of the day, Australia is the largest continent on earth. We are so widespread, and it's a logistical mission to distribute vaccines across the country. But the big lobbying argument has been, well, utilize, the local resources to help do that. And we're starting to see more and more of that actually being utilized. This past week, we've seen dozens of new pharmacies come on board and started to deliver vaccines to their COVID-19 vaccines to their local communities, which has been fantastic. But one thing I really wanted to mention is, while all of this, this lobbying about utilizing the local resources to deliver these new services, I want to just touch on the fact that the current services utilized or even offered by your local healthcare provider are already so underutilized. And I really wanted to highlight that, because I was just chatting with a pharmacist recently about the way in which they deliver their services in their pharmacy and the uptake of these services in that business. And it really surprised me that it was quite low. For example, did you know that you can go into your pharmacy, and if eligible, if you're on something as simple as five or more medications, or you're on some medications that carry significant risk of side effects or complexity in your treatment regime, that you can spend time with a pharmacist for free for them to evaluate your medication. And if eligible, that interaction can even be done in your home. Yet we look at the utilization of these services, and it's really startling to see that across the country, that the utilization of the services already on the table from your local healthcare provider are actually really, really low. Now, my question to you is, one, why? Why is this the case? Is it because you just don't know what services are out there and what services exist from your local healthcare provider? Is it because that they're deemed to be too inaccessible? And I'd argue that, given that frontline healthcare, particularly in Australia, particularly in pharmacy, is probably the most accessible healthcare providers probably in the world, at least in the developed world, that's for sure. When we look at GP rates, we are so blessed through our Medicare system, and the bulk billing system and the accessibility to great doctors at affordable prices or even no out-of-pocket expense. And so when we look at that, is it an accessibility question? Or is it because we simply don't value what services are on offer and the services that actually can meaningfully impact our lives or impact the lives of our loved ones. So to me, there's two sides of the coin. Is one is the healthcare provider not really educating our patients, educating our consumers enough to know what services are offered. And the other side is, are we as patients and consumers not asking the questions to our healthcare providers about what options and services are actually available, how we can better our own health, the health of our loved ones, and the health of our communities? And to me, there's two sides of that coin, because it's very easy to point the finger to that, to one party, to say, well, I'm promoting, but the patients aren't taking it up, or the patients, aren't using what's on the table, and, we're just wasting funding. And this becomes a really holistic argument, is particularly when there's public funding involved, because at the end of the day, there's only a pooled resources of funds. And if those funds aren't utilized in that budget, when the next budget comes, they're going to look and go, well, wait a minute, this service is failing. This service isn't working. And I would argue that strongly, because I know personally, and when working with pharmacy owners, that's a really, and with small healthcare businesses, that's a really big important factor, is that we are utilizing everything on the table. But as entrepreneurs and healthcare professionals, we have a real big problem with shiny object syndrome. Oh, what's the newest thing out there? Let me go and take a look at that. Rather than really owning what we already have and what we already can deliver to our community. So that's my challenge, I guess, for you today, is to really look at where you're going in this service delivery space. Why the obsession just with COVID-19 vaccination rollout? Why not look at your business holistically and go, well, what is the best service delivery I can deliver to my patient with what I have today, not just what I've been promised for tomorrow? Because we've all been waiting for, say in the pharmacy world, we've been waiting since, our expressions of interest went out in February. And we were told, very, very quickly early on that, we would hear back in February about these expressions of interest and to start rolling out very, very soon. We're already almost at the middle of July, and we're only starting to see that iceberg happen. And to me, that's almost, 5-6 months of time wasted focusing about this new shiny object, rather than ensuring that our patients are getting the maximum benefit out of all the services that we offer. And when we're talking about vaccinations right now, there are around 10 different vaccinations that you can get from your local pharmacy, depending on your state or territory and the jurisdiction, with some of these vaccinations being able to be delivered to as young as 10 years old through your local pharmacy. Now, did you know that? Did you know that, if you've got a loved one that is pregnant, that you can go and get your whooping cough vaccine from a pharmacy? Probably not. It startles me that, that our role in the vaccine delivery is so much broader than just COVID-19 and influenza, yet it's not utilized because it's not known. So my challenge to you now is, how are you going to change that narrative? How are you going to, as a business, as a health entrepreneur, how are you going to change that narrative in your local community to make sure that your community are benefiting from all of the services that you provide? And how are you, as a patient or a consumer or a customer, in your own right as a health entrepreneur, going to utilize those services of others to better your own life, to maximize your own well-being? And that's my challenge to you, is that utilize what we already have. And we have so much, yet we keep looking towards the next thing. Stop, take into account what we have right now, and utilize what we have, because what we have right now is so amazing, and whatever we layer on top of that is only going to make it more amazing in terms of the services and utilization of the amazing teams and talent and healthcare professionals that we have in our community. But if we don't use whatever is already there, whatever already there will be lost, and it will be a lot harder to grow from that, because at the end of the day, if we're not using what we already have, it's perceived as not being valuable. Even though I know, based on my own accounts, based on chatting with so many other people in my profession, in the healthcare profession, the impact that our services have on our community, and the miraculous changes that they have on people's lives. And that's why they're there, because it's been proven that they have great impacts. But now it's the time to use it. So that's my challenge for you today. A bit heavy, but I wanted to end, I guess, coming towards the end of the week. And tomorrow, as you know, if you're just joining on with us right now, and the reason why I'm addressing this to the Limitless Network is I'm creating a like-minded community of health entrepreneurs, whether you're a business owner, whether you're just a person in a community, whatever shape or form. If you strongly believe that you're a health entrepreneur, then this is a great community for you. And tomorrow, I'll be deep diving in Tea with Z on a really topical conversation about the isolation and things that have caused have been a result of COVID-19, but also the isolation that comes through entrepreneurship. And that's what this Limitless Network is all about, because sometimes it can be lonely, and we're going to touch on that tomorrow, so I'm not going to deep dive into that today. But if you want to know more about the Limitless Network or subscribe to the Limitless Network, this is the link. Feel free to jump on or search for this group. Now, group is growing every day, each and every day, which is absolutely amazing. We're absolutely loving it. So jump on to the Limitless Network. We'd love for you to join this like-minded, peer-supported community, and we really look forward to seeing you there. So like I said, that's my challenge to you, is go and ask these questions of your patients, of your consumers, but as a patient and consumer in your own right, as a health entrepreneur, I challenge you to start taking control of your health journey through better questioning of your support network, the people that are there, the professionals around you to help you. So that's my challenge to you today. So yeah, that's all for me today. Have a fantastic day, and yeah, I do look forward to seeing you very, very soon. And like I said, tomorrow, if you're watching this on YouTube or on our Facebook page, you won't see me there, because we'll be exclusively streaming in our Limitless Network. So if you want to jump on, definitely make sure that you request membership today, and I'll see you in the Limitless Network tomorrow. Have a great day.